guys, welcome back to me. My name is Rika Octaviola, and this time I want to answer the question of my lecture again about case study 1. And the title of case study 1 is privacy, and this is the case. Dr. D was an obstetric or gynecology resident pursuing a joint residency at the State University Medical Center and the regional hospital. During an invasive surgical procedure, Dr. D was accidentally cut by the attending physician. The record does not indicate whether there was any actual blood contact between Dr. D and the patient. It appears there was no blood exposure, although no one can be certain. The following day, Dr. D voluntarily submitted to blood testing for the HIV virus. The result confirmed that Dr. D was HIV positive. After being informed of the test results, Dr. D willingly withdrew from participating in further surgical procedures, informed the appropriate official of his condition, and requested a voluntary leave of absence. Upon investigation, the medical center identified 279 patients who had been involved to some degree with Dr. D during the course of their medical treatment. Likewise, the hospital identified 168 patients who had been in contact with Dr. D since the time of his joint residency. Unfortunately, hospital records do not necessarily indicate each time a physician is cut, nor do they specify the distinct role of each physician in a surgical procedure. Thus, every patient with a reasonable chance of exposure to Dr. D was included in the statistic outlined above. Both the medical center and the hospital filed petitions alleging a compelling need to disclose information regarding Dr. D's condition to those patients potentially affected by contact with him. In addition, the hospitals believe there was a compelling need to disclose Dr. D's name to the other treating physicians in the department, so that those physicians could contact their patient in the event they had been assisted by Dr. D in any invasive procedures. In response, Dr. D asserted his right to privacy, arguing that no compelling need was tantamount to a justification to disclose his HIV-related information. Unsubstantiated patient notification. Expensive medical care will become even more costly due to needles, repeated HIV testing, and the high cost of doctors' indemnity insurance. Furthermore, physicians and other healthcare workers will be discouraged from treating those infected with HIV. My opinion is the right to privacy is an integral part of the inherent right of every human being to dignity. It represents the right of every individual to determine when and how much personal information will be exposed to the public. Every human being has a right to privacy, and thus, patients as well as practitioners are entitled to it. This right actually enables individuals to maintain their autonomy and to live as they want. This is my opinion and my answer. Thank you for watching. Bye.